Hey, welcome. This is Here's to Good Health. My name is Linda Prezioso. I'm a nurse practitioner at Family Medical Center, and this show is for you, by you, and about you. This is a community service program sponsored by WHIG-TV, and we're very grateful that they care enough about you and your health to have me come on and talk about different things. So I've got a variety of things to talk about tonight. If you've got an interest or a question, be sure to give me a call, 407-1111. Otherwise, I'll just rant on about what I've chosen to talk about tonight. Since it's October and it's Breast Cancer Awareness Month, I decided we'd go just kind of start to the basics, like what is a mammogram? So a mammogram is an x-ray, a picture of your breast. Doctors use mammogram to look for early signs of breast cancer. Regular mammograms are the best tests that doctors have right now for breast cancer, and they can find cancers in your breast up to 3 years before it could be felt or before it would manifest itself. So you think about that, that's really 3 years. A lot could happen in 3 years, so we're grateful for that. And we have a great mammography department here in town, the Nash Breast Care Center, and they do a fabulous job. I'm hoping we'll get to have one of them on with us this month. I know we're going to have a cancer doctor talk about breast cancer later in the month, but anyway, so I don't know, probably most, if not every woman that's listening to this program has had a mammogram, and they can be uncomfortable depending upon who does them and how gentle they are. But a mammogram is a special x-ray machine, and the technologist will take your breast and place it on a plastic plate. So it's placed here, and then there's another plate that comes down like this and flattens the breast. They want it as flat as possible. Well, you know, our breasts aren't flat, they're rounded. So that can be, depending upon how much pressure they put on that top plate to flatten your breast. And then the plates hold your breast still while they're taking the pictures. And of course, you'll have to hold your breath as well. You'll feel some pressure, and then, you know, those steps are repeated for each breast, the right and the left. And then the technologist will check the films to make sure that they're good and that they're readable before she'll let you go and get dressed. And then you have this frontal view where the breast is flattened, and then you also have a side view where you have to hold your arm up, and they take the breast and put it, you have to kind of lean over, and they put it on there, and they do a side view as well. So it's uncomfortable, I think. We had a great mammographer in our office, Susan. She moved to Florida, so we don't have her anymore, but most everybody that had their mammogram done by her always expressed to me how good it was, and she didn't hurt them. So it says, what does a mammogram feel like? Well, it's uncomfortable, as I've said. Some people find it very painful. I've had patients that will not have another one because it hurt them so bad. It only takes a few minutes, though, and the discomfort is soon over. As soon as they lift up the plate, the plastic plate off of your breast, the discomfort goes away. It doesn't linger. And you know, some breasts are more sensitive. If you've got something called fibrocystic breast disease, that makes breasts very tender and painful. So, and you know, it just depends upon who you are. Your breasts are always more tender around your menstrual cycle. And then the radiologist, he has special training in reading. Well, radiologist is really all x-rays, but they have special training in reading mammograms and to be looking for any abnormalities. So, it's really important to do it early. Mammograms start at age 40 for women. They start earlier if you have a family history of breast cancer, then some women get them at 25 and 28, depending upon what their history is. And NASH also has a great, department for detecting, family, doing DNA and things like that. So they're really on top of it over there. I'm very proud to say that we have such a great scanning and great mammogram services here in town. And then, once you have the mammogram, then the radiologist reads it, and then he sends a report to me or whoever your provider is, and then a lot of times they tell you right then and there it looks okay. Sometimes they don't. It just depends upon, I guess, how busy they are or whatever. But then your doctor should contact you. I think NASH sends a letter to the patient herself saying, it was fine or whatever the results are. But I usually try to have my nurse call my patients as well, just to make sure that they did get the information. And that usually you get in a week or two after. I don't know why I'm so fidgety tonight. So if your mammogram is normal, then you will have your mammogram once a year. That's the recommendation, once a year. And then I think it's always good to go to the same place to have your mammogram done if you can, because then that radiologist can look from year to year, and if he sees something suspicious on today's view, he could look back last year or the year before and see if there was anything suspicious looking there. So I think it just helps, and I think it's just good continuity of care. And if your mammogram is abnormal, that doesn't mean you have cancer. There's lots of different things that can be going on in the breast besides cancer. You might need some additional mammograms. You might have to have an ultrasound. You might have to have a biopsy. There's other things that need to be done. So that will help determine if you do have cancer, if you need to see a surgeon, or what it is and how it's going to be treated. And so then, who do you talk to about your mammograms? You can always talk to your doctor. There's a National Cancer Institute. You can find that online. You can call them. Medicare has a number for anybody that's on Medicare. And then CDC has a National Breast and Cervical Cancer Early Detection Program that works with health departments and other groups to provide low-cost or free mammograms for those who qualify. Because if you don't have insurance, it can get to be a little dicey, because it's, stuff like that's expensive. I don't know what it costs, but I know it costs more than what you and I could afford. So let's just go over a few breast cancer statistics. About 1 in 8 women in the United States, or 13%, will develop invasive breast cancer over the course of her lifetime. In 2021, it was estimated that 281,550 new cases of invasive breast cancer were expected to be diagnosed in women in the U.S., along with 49,290 new cases of non-invasive breast cancer. About 2,650 new cases of invasive breast cancer are expected to be diagnosed in men. A man's lifetime risk of breast cancer is about 1 in 833. So you don't see it very often. I have never seen it. I've been in practice 10 years. I think I've sent 2 men to the breast care center, and neither one of them had cancer, thank the Lord, but they did have breast pain. And this is very sad. About 43,600 women in the U.S. are expected to die in 2021 from breast cancer. Death rates have been steady in women under 50 since 2007, so that's good news. And they have continued to drop in women over 50. The overall death rate from breast cancer has decreased 1% per year from 2013 to 2018. These decreases are thought to be the result of treatment advances and earlier detection through screening. And you know, now they have the 3D mammogram machine that it just shows more in depth. So that's really, you know, that's really good. And I think that's a standard over at the breast care center. In our office, we did not have a 3D when Susan was with us, but they are, the owners are looking into obtaining a 3D machine in our office. So we'll see what happens with that. You know, everything costs a lot of money, so it's always a, if we buy this, how long does it take to pay it off, stuff like that. So I'll keep you posted for anybody that comes to my office. Let's see, where have I been? For women in the U.S., breast cancer deaths are higher than those for any other cancer except for lung cancer. As of January of 2021, there were 3.8 million women with a history of breast cancer in the United States, and that number includes women that are currently being treated and women who have just finished treatment. Breast cancer is the most commonly diagnosed cancer amongst women, in American women. In 2021, it's estimated that about 30% of newly diagnosed cancers in women will be breast cancers. Breast cancer becomes the most common cancer globally as of 2021, accounting for 12% of all new annual cancer cases worldwide, and that's according to the WHO, World Health Organization. In women under 45, breast cancer is more common. And it's more common in black women than white women. Overall, black women are more likely to die of breast cancer. For Asian, Hispanic, and Native American women, lost my place here, the risk of developing and dying from breast cancer is lower. And then a certain kind of Jewish women, it's Ashkenazi Jewish women have a higher risk of breast cancer because of a higher rate of the BRCA mutations, although that is not limited to that Jewish community, because I've got a good friend, her mama died from BRCA, and her baby sister died of BRCA, and in men she has a brother and he has prostate cancer, and that BRCA gene goes into prostate in men where it goes into the breast in women. So it's not just limited, it's just higher in that particular sect of Jewish women. Breast cancer incidence in the United States began decreasing in the year 2000 after increasing for the previous 2 decades. They dropped by 7% from 2002 to 2003 alone. One theory is that this decrease was partially due to reduced use of hormone replacement therapy by women after the results of a large study called the Women's Health Initiative that was published in 2002. These results suggested a connection between HRT and increased breast cancer, although most of that has been debunked since then. They did have a higher incident, but the population that they used in that study also, they were older, they were already sick, they already had things going on, some of them already had breast cancer. So it wasn't, the findings weren't as respected as they should have been. So hormone replacement therapy, and I probably need to have a whole show just on that. But, that hormone replacement therapy is for the treatment of hot flashes, the treatment of mood swings, brain fog, things like that happen to women during menopause. And the hormone replacement treatment is safe. So I'll just do a show on that alone. And then a woman's risk of breast cancer nearly doubles if she has first-degree relative, that's a mother, sister, or daughter, who have been diagnosed with breast cancer. And less than 15% of women who get breast cancer have a family member that was diagnosed with it. About 5 to 10% of breast cancers can be linked to gene mutation inherited from one's mother or father. And again, that's the BRCA gene. There's a BRCA1 and a BRCA2. On average, women with BRCA mutation have up to 72% lifetime risk of developing breast cancer. That's a high number. For women with a BRCA2 mutation, the risk is 69%. Breast cancer is positive for BRCA1 or 2 mutations tend to develop more in younger women. My friend I was telling you about, her mom, my friend was one of 6, she was the oldest of 6 children, and her mother died of breast cancer when my friend was a junior in Chapel Hill. She's a nurse. She was in nursing school there. So that let her be, about 20, 21. And then as their lives progressed, then my friend's baby sister, the baby of the 6, developed breast cancer, and I think she died in her 50s. So I guess their mom died in the late 40s, early 50s as well. Now the brother that has the prostate cancer, he's second, and I guess he's probably 65 to 66 in there. So it didn't affect him as early as it did his mother and his sister. An increased ovarian cancer risk is also included in those genetic mutations of the BRCA1 and BRCA2. And BRCA2 mutations are associated with a lifetime cancer risk of about 6.8%. BRCA1 mutations are less frequent cause of breast cancer in men. About 85% of breast cancers occur in women who have no family history of breast cancer. This occurs to genetic mutations that happen as a result of the aging process and life in general, rather than inherited mutations. And the most significant factors for breast cancer are sex. If you're a woman, you're going to have a higher risk than a man, and age. The older you get, the higher potential you have to get breast cancer. And so I just wanted to kind of highlight some of those for you. Before we go into what I'm going to talk about next, I think we'll take our first break. And so when we come back, we're going to talk about functional medicine and integrative medicine. I wonder if you've even heard of those terms, but we'll talk about that when I come back. So don't go away. I'll be right back with more of Here's to Your Good Health. Hang on.
At Down East Hearing Care Associates, we are dedicated to taking care of every client by providing personal, high-quality hearing care services. My staff and I know hearing loss affects each person and their loved ones differently, so we give you the time and the care you need to ensure the hearing technology chosen fits your lifestyle. At Down East Hearing Care, we also make custom ear molds and specialize in emergency hearing aid repairs. Down East Hearing Care Associates has 2 locations, one in Knightdale and one in Rocky Mount. We have hearing lives to save.
Hi, I'm Richard Koss, pharmacist and owner of Almonds Drug Store here in Rocky Mount. Here today with my wife and 2 daughters. For over 75 years, Almonds Drug Store has been the pharmacy of choice for residents of Edgecombe and Nash County. Our family is proud to call Rocky Mount home, and we are excited about the new services and products we are adding daily at both of our Almonds Drug Stores locations and also at our medical supply store.
Come in and see us at Almonds Medical Supply. We're an extension of Almonds Drug Stores, your local hometown pharmacy. We're here to service all your needs, from wheelchairs to walkers to orthopedic supports to compression hose to hard-to-find wound care supplies. And you'll always get that hometown customer service.
We want our patients to pay the best prices, get the best service available, and have a better pharmacy experience than they will get anywhere else. Our staff is committed to going above and beyond to meet our patients' needs. Whether it is working with your provider to get you the best medication at the best price, contacting your provider to get you refills or a prior authorization, or taking the time to review each of your medications with you personally, or perhaps even helping you find an old-time remedy or other hard-to-find items, your Almonds Drug Store staff will work hard to meet your pharmacy needs. At Almonds, we will deliver your prescriptions for free. Both of our stores have drive-through windows, we guarantee short wait times, and our pharmacists will come out to greet you personally and answer any questions you have. If you want to be met with a smiling face, or even want someone to greet you by name when you walk through the doors, we are the pharmacy for you.
Call Almonds Drugs today.
443-3138 or 446-0014.
All right, hey there, I'm back. This is Linda Prezioso. I'm a nurse practitioner. This is Here's to Your Good Health, where we talk about things for you, by you, and about you. I try to bring in interesting topics that I think you'll enjoy and learn from. We just talked a little bit about breast cancer. I didn't want to go and do a whole show on it because I think there's more coming up this month, as this is Breast Cancer Awareness Month. So I didn't do a whole lot of that. So I decided to talk to you a little bit about functional medicine and integrative medicine. You thought all medicine was alike, didn't you? Well, there's a traditional medicine, which is what most doctors do, and there's certainly nothing wrong with that. I do a lot of that myself. But there are some forms of what they call alternative medicine, which and that's functional and integrative. And that's really been catching on with popularity. More and more people are wanting a different approach to their health care. More and more people are wanting more time with their doctor and not being shuffled in and out in a 10 or 15 minute slot. And so it's just becoming more and more popular amongst folks. And I think, the general population is becoming more and more educated on how they can be treated and different ways to be treated. And I, for one, I'm sure this doesn't surprise you, I'm all about alternative medicine. I'm all about natural medicine as much as possible. Now, am I going to send you to a cancer doctor if you have breast cancer? Absolutely. I'm not going to go into a shaman or a witch doctor or anything else for healing of something like that. But I think simple aches and pains and different various ailments you have, for instance, tennis elbow. I had tennis elbow when I worked in the emergency room years ago, and I had several treatments of the traditional medicine, which is, and they still do it today, which is injecting your joint with a combination of lidocaine to dull the pain, and then a steroid to decrease the inflammation in the joint. That's why it hurts, because of the inflammation, whether it's a tendon. Most of the time it's the tendon. So I had 3 or 4 of those injections, and they worked for a couple weeks, and it came right back. And so at that time, one of the doctors that worked in the ER that I worked with also had, he had been an acupuncturist. He was from Malaysia, so from the eastern part of the world. And when he came down here from Toronto, but when he lived in Toronto, he had an acupuncture clinic along with his his regular medicine clinic. And so he did acupuncture on me. I think I had 2, maybe 3 acupuncture sessions with him. I've never had the problem since. I've had different areas where I've had tendinitis and I've had to have acupuncture again. But I am a firm believer in acupuncture. There's no medicine involved. It's your body's natural way to heal. The needles are injected. You have several needles that are put in. They're very fine needles. It hurts less than a pinprick. And they put them along the pathway, the nerve pathway, and stimulates that pathway to send healing into whatever, like your elbow or your shoulder or whatever it is that you're having the acupuncture for. I think, I can't speak 100%, but the majority anyway of chiropractors here in town do the acupuncture. We do not have a Chinese medicine doctor here. So, some people think that they are the best at acupuncture. Maybe they are, I don't know. But I've used various chiropractors here in town for my ailments, and so I tell my people, anybody with tennis elbow, anybody that has carpal tunnel syndrome, I tell them they should try acupuncture. Some people are more than willing to try. Other people say, no, I want to go get the shot in my elbow. Okay, that's fine. I wouldn't push my beliefs and my ideas on anybody. I just tell you what all of the opportunities are out there for healing, the various different ways of healing, and then you can decide what's best for you. Now, the thing is, I don't think insurance pays for acupuncture. You might have chiropractic benefits on your insurance, and it might be paid that way. I'm not sure, so I can't tell you about that. But anyway, that's just one example of alternative medicine or functional medicine. There's quite a few different renowned healthcare practitioners. Deepak Chopra, Dr. Deepak Chopra, if you've ever heard of him. Mark Hyman and Dean Ornish, just to name a couple. A lot of people believe that functional medicine is the future of medicine. Physicians are beginning to take a more holistic approach to treating patients, no longer just concentrating on a specific disease. Although functional medicine and integrative medicine have similarities and overlap in several areas, there are a few factors that make each one different and unique. So we're going to go over those right now. So what is integrative medicine? Integrative medicine is a holistic medical discipline which takes into account the lifestyle habits of a patient. The physician works to treat the whole person rather than just the disease. The mind, body, and soul of a patient are taken into consideration to promote healing and well-being. Integrative medicine uses a combination of modern healthcare practices to diagnose and treat a patient. Treatments include modalities such as acupuncture, yoga, massage. The medical practice also focuses on the nutritional and exercise habits of the patient to curb factors related to obesity and diabetes. Integrative medicine physicians believe poor lifestyle choices are the root of many modern chronic diseases, and I totally agree with that statement. So what's functional medicine? Functional medicine embraces much of the philosophy of integrative medicine as described, but also employs a system-oriented medical approach that works to identify and understand the underlying or root cause of the disease. This discipline takes into account the personalization of healthcare. Each patient's care plan is distinct and unique. The relationship between patient and practitioner is reviewed in detail. Much like integrative medicine, functional medicine treats the individual rather than the disease. And that's one of my big concerns as a provider. You know, I firmly believe that a lot of diabetes, high blood pressure, high cholesterol is from the way we eat and lack of exercise. Now, there are people that have, you know, diseases in their family and it's passed down from one to another. There's DNA that is more susceptible to some of these diseases than others. But the standard American diet is not healthy, and it opens you up for being sick. And so, you know, I'm big on diet and exercise, and anybody who watches this program knows I harp on it till I'm blue in the face. Often individual genetic and environmental research is conducted to obtain a deeper knowledge of the patient's health status. Understanding the biochemical individuality of a patient can lead to the underlying cause of disease and, furthermore, the prevention of additional health risks in the future. Functional medicine has gained much popularity, even spurring the creation of the Institute for Functional Medicine. There's also an Institute for Integrative Medicine. Personalized medicine is without a doubt the future of medical care. So, I was going to say something and I totally forgot. It'll come back to me. Although integrative medicine and functional medicine have similarities, there is one distinct, important distinction. Both practices focus on supporting the person as a whole person. However, functional medicine strives to determine the root cause of each and every disease, particularly chronic disease such as autoimmune, cardiovascular diseases, as well as diabetes and obesity, rather than simply making a diagnosis and then determining which drugs or surgery will best treat the condition. And that's pretty much traditional medicine. You come to my office, your sugar's high, your A1C is high, I label you diabetic, and I give you medicine. There's nothing wrong with that. It happens every day, and people are grateful for it. But functional medicine practitioners dive into the patient's history, biochemistry, and ask why this patient is ill. Functional medicine is highly personalized and often includes a detailed analysis of an individual's genetic makeup. I remember I was going to tell you, I listen to a lot of different podcasts and YouTube in the morning. I don't have TV, and I don't listen to the news. I wouldn't anyway, because it's all bad news. I can look on my phone and find out if it's going to be sunny or rainy. That's all I need to know. So one of the ladies I listened to, she lives in New York, and she was in Oklahoma, and there is a functional medicine man there, or a doctor, not a medicine man like in the Indian culture. But and so she has gone to him, even though she was in Tulsa, Oklahoma, where this gentleman has his clinic, and so she saw him there. And one of the blood tests that he does, you know, we in traditional medicine will check for your sugar and your cholesterol and your liver function and your kidney function, things like that. But functional and integrative functional medicine goes a step further. He draws, along with his regular standard labs that I would draw, he does a DNA panel to see what diseases you could be destined for as you age. What is in your DNA that is going to cause you disease down the road? And then they try to determine what that is and block it, stop it from happening, whether that's through diet, exercise, whatever, you know, that's determined by the blood. I thought that was fascinating. There is no way I could do that. I mean, when you go to an integrative or functional medicine person, you're talking, they're going to spend an hour or more with you, especially your first visit. You know, I get 30 minutes for a new patient. I get 15 minutes for somebody I see on a regular basis. So there's no way that traditional medicine can do all these things. And that's kind of where I think they butt heads, because I believe every doctor, he's gone to school for all these years to be a doctor to help people. He certainly would want to do all that, but the way our medicine and our medical way is set up, there's just no time for that. And of course, if you see fewer people, then you're not going to make as much money, and we all become some kind of a professional, or we all get some kind of a certificate, or we all go to school to be a plumber or a HVAC guy to make money. Hello, we want to buy a house, we want to buy a car, we have clothes we need to put on our backs, we have food to put on our table. So, you know, these integrative and functional medicine guys don't see as many patients as like I do in a day, and that makes a difference too. So there's lots of varying factors of why some go to functional medicine, integrative medicine, or traditional medicine. I try to blend that in mine. I can do a little bit of integrative, a little bit of functional, more integrative than functional, but then I still use the traditional medicine, because if, like I said before, if you come in and your sugar's high, I'm going to give you a pill for that, and I'm going to talk to you about diet and exercise. I'm going to talk to you about what you should eat in a limited way, because I don't have a lot of time, and then I'll see you back in 3 months. I mean, that's kind of the way it is. So anyway, that no, I got a few more minutes. Healthcare is undergoing drastic changes here in this 21st century. And you know, with this pandemic, everybody and everything is going through dramatic changes. I mean, our whole world is upside down. Things that we took for granted, we no longer have. You know, you're hearing all these stories now of ships off the port of Los Angeles. I think there's 36 ships or something waiting to be unloaded. I don't know what the problem is, where the issue is, why they can't be unloaded, but they're not being unloaded. So, you know, now, I mean, I've never in my lifetime remembered going to the grocery store and seeing empty shelves, unless they had a big sale, buy one, get one free, or, you know, you're getting your turkey for 5 cents a pound, something like that. But I'm talking, you know, I like Jimmy Dean breakfast products sometimes for breakfast. Sometimes I don't feel like cooking myself, and so I'll get one of his breakfast bowls. And the last couple of times I've been in the grocery store, they have not had any, or they've had just a few, not necessarily the ones that I like. So we're seeing that more and more of empty shelves and things like that. So this whole 21st century has been a big change. It's not just in medicine. So in as few as 5 years, we can look back and ask ourselves how we could have been practicing medicine so primitively. Those practitioners who embrace the functional and integrative medicine paradigms will be at the forefront of healthcare in the 21st century. And if you want to know more about that, you can Google and find, I don't know where there are any integrative or functional medicine docs here. I know Holly Parker in Wilson does some functional medicine. I think that Dr. Michael in his MD VIP does a little bit more functional or integrative medicine. But, and that's another thing, it's called concierge medicine, I guess, where, you know, you pay a standard fee, and then that doc is on call to you 24/7 for the whole year. And that's something else that's coming into vogue, and so we'll see what happens with that. I see more and more people popping up with that too, so we'll see. All right, it's time for our break, and when we come back, we'll talk a little bit more about integrative medicine and what we can do to maybe get some providers here to take care of us with these things. So don't go away, we'll be right back. Hang on.
At Down East Hearing Care Associates, we are dedicated to taking care of every client by providing personal, high-quality hearing care services. My staff and I know hearing loss affects each person and their loved ones differently, so we give you the time and the care you need to ensure the hearing technology chosen fits your lifestyle. At Down East Hearing Care, we also make custom ear molds and specialize in emergency hearing aid repairs. Down East Hearing Care Associates has 2 locations, one in Knightdale and one in Rocky Mount. We have hearing lives to save.
When faced with special care needs for elderly or disabled loved ones, families want compassionate, comforting care. That's Tender Touch Home Care Services' goal, providing the level of care we would expect for our own. With over 10 years of home care excellence, Tender Touch provides an array of services that keeps your loved one at home. From personal care, light housekeeping, errands, and meal preparation, to our private duty care program, which combines all of our home care offerings in one package.
Tender Touch Home Care Services, where your needs are our concern.
Hi, I'm Richard Goss, pharmacist and owner of Almonds Drug Store here in Rocky Mount. Here today with my wife and 2 daughters. For over 75 years, Almonds Drug Store has been the pharmacy of choice for residents of Edgecombe and Nash County. Our family is proud to call Rocky Mount home, and we are excited about the new services and products we are adding daily at both of our Almonds Drug Store's locations and also at our medical supply store.
Come in and see us at Almonds Medical Supply. We're an extension of Almonds Drug Stores, your local hometown pharmacy. We're here to service all your needs, from wheelchairs to walkers to orthopedic supports to compression hose to hard-to-find wound care supplies. And you'll always get that hometown customer service.
We want our patients to pay the best prices, get the best service available, and have a better pharmacy experience than they will get anywhere else. Our staff is committed to going above and beyond to meet our patients' needs. Whether it is working with your provider to get you the best medication at the best price, contacting your provider to get you refills or a prior authorization, or taking the time to review each of your medications with you personally, or perhaps even helping you find an old-time remedy or other hard-to-find items, your Almonds Drug Store staff will work hard to meet your pharmacy needs. At Almonds, we will deliver your prescriptions for free. Both of our stores have drive-through windows, we guarantee short wait times, and our pharmacists will come out to greet you personally and answer any questions you have. If you want to be met with a smiling face, or even want someone to greet you by name when you walk through the doors, we are the pharmacy for you.
Call Almonds Drugs today.
443-3138 or 446-0014.
Hi, welcome back. This is Here's Your Good Health. I was just looking over my notes, and we really did go over both integrative and functional medicine. So I'm going to move on to my next topic, which I thought was kind of interesting. I had a patient today who had this diagnosis, and so I thought, well, we'll just talk about that tonight too. I told you we're going to talk about several different things. So she has a diagnosis called pulsatile tinnitus or tinnitus. Now, tinnitus is a ringing in your ear or a hearing of something in your ear. You know, you shouldn't hear something, a buzzing going on all the time. You're only supposed to hear the noises that come in so you can hear, you know, voices and music and that kind of thing. But if you have a thumping or a whooshing sound in one or both of your ears that seem to follow a steady beat, you may have this rare form of tinnitus. And my patient today said that she doesn't hear it when she is up and sitting up and moving, but when she lays down and she's got her ear covered, you know, on the pillow, she hears it. And she checked her pulse, and the thump and the pulse were, you know, together. They were synchronized. So it was her heart. She said, I can hear my heartbeat in my ear. And it was new for her. She hadn't done it before. So so I decided that I'd look it up and we'd talk about it. So, you know, regular tinnitus, you hear this constant sound that others don't. But with pulsatile, form of this condition. The noise comes from inside your body. Your doctor may be able to hear it too if he can listen with his stethoscope. It's also called rhythmic, vascular, or pulse synchronous tinnitus. So the symptoms are you regularly hear a sound with a steady beat that seems in sync with your pulse. You may hear it in only one ear. Excuse me. And my patient my patient only heard it in one ear. For many people, the sound can be loud and distracting, even unbearable at times. You might notice other symptoms, like you might have high pressure in the fluid around your brain, called idiopathic intracranial hypertension. And idiopathic means they don't know where it comes from. And intracranial means in your head, in your brain. This is your cranium. Hypertension, which is high blood pressure in your head, basically. And that you can have headaches, dizziness, vision problems, hearing loss. If you have idiopathic intracranial hypertension, you may need to lose weight, take medication, or have surgery. Well, let's just lose the weight and forget about the surgery if we can. Unlike with regular tinnitus, which you can't really pinpoint, there's really no cure for regular tinnitus. Doctors can often pinpoint a specific problem with this pulsatile tinnitus. Irregular blood vessels might be the problem, and that's a common issue when the blood flows through damaged or kinked vessels. You know, your vessel can kink just like a hose does. You know, if you're out watering your grass or your flowers and the hose kinks and you don't have any water coming anymore, well, that can happen to your blood vessel, and then you're not having the blood flow that you need to a particular part of the body, which is not good. So you could have a kinked vessel in the brain near or around the ear, and that can cause a change in pressure and a noise, so it could be that. A narrow or kinked neck artery, the carotid artery or vein, the jugular vein, can also cause the sound. High blood pressure can lead to a change in blood flow, and things like stress, alcohol, and caffeine can make the noise more noticeable. You can have severe anemia or an overactive thyroid gland, and that can cause it. And then you have fats that can clog your vessels. That's what we call atherosclerotic disease, and that is you get plaque built up in your arteries, and that plaque can break off, and it can go up into your brain and give you a stroke. It can go down into your heart and give you a heart attack. It can go into your lungs and give you something called pulmonary embolus, which will cause shortness of breath and death. All three of them can cause death. The blood flowing near your middle and inner ear move with more force, like water through a narrowed steam bed. And so head and neck tumors can press on blood vessels and make noises. Connections between arteries and veins in this condition is called arteriovenous malformation. You can have that. I've seen that many times in patients. It's not as uncommon as we think. So there's a lot of things that it could be. So when I saw this patient today with this pulsatile tinnitus, I knew that was just the beginning of me seeing her, because I sent her to ear, nose, and throat first. We'll rule out if she has anything in her neck or her head, any malformation of any sort that would be causing that. If that's okay, then we're going to have to look into things in her arteries and veins, which would be a carotid ultrasound and probably a trip to the heart doctor and maybe even have a cardiac cath to see if she's got any plaque or buildup that could cause a heart attack or a stroke in her, and get that treated. So I've just begun my treatment with her, even though we've already got the diagnosis. Now we have to know why she has that diagnosis. So I'll keep you informed. She's very interesting to me. I know her. I worked with her in the hospital. She's a very nice lady. I've enjoyed her for many, many years working with her, and now she's my patient. And so I certainly want to make sure she gets the best care she can. So we'll start with the ear, nose, and throat, and maybe it's something simple in the one ear, and that's all it'll be. I hope that's it for her sake. All right, so I'm going to go back to functional medicine a little bit here, and this is reversing the chronic disease trend. 6 steps to better wellness. And you know, I'm all about wellness, and I'm all about taking care of ourselves, and I'm all about doing everything we can do. And let me see here. Some of this stuff I don't think we need to talk about. All right, so this is something that functional medicine would do, and integrative medicine doesn't really do this. So they'll do a matrix of triggers of a disease. So we're going to go into the chronic disease epidemic. So poor nutrition can cause that, sedentary lifestyles, chronic stress, poverty, if you can't afford fresh fruits and vegetables. Now everybody can move, because anybody can go and walk. You don't have to belong to a gym. You don't have to have the money to go to the Y and swim. But some people in poverty don't live in very good neighborhoods, and so that really causes a problem for them to walk as well. They might not have a car where they could drive to the mall and walk at the mall. Environmental toxicity, you know, you hear all the time about these old houses that have lead-based paint, or they're still pulling asbestos out of old factories and old buildings. You know, we've known about asbestos for years and what that can cause in our lungs, and they're still pulling it out of attics. Fragmented social networks, chronic infections, aging population, those are all factors that can, so you have your chronic disease epidemic here in the circle, and then outside of that is the nutrition and the environmental toxicity, sedentary lifestyles. So you start out with, functional medicine starts out with, what is the problem? The problem is the chronic disease epidemic. What are the factors that point into the chronic disease, which I've just outlined? And then you go into, you might even look at genetic factors as well. And so then how are we going to fix it? Well, we got to figure out what the root cause is of each individual. So my chronic disease epidemic is not, it's not poverty, and it's not a fragmented social network. I don't think it's environmental toxicity, although I live in the country, so I could be getting some of chemicals put into farmland that is seeping down into my well that would cause it. I don't have chronic infections. I don't have a sedentary lifestyle. I get up and I move. I try to get at least 6,000 steps during the week. I try to get 10,000 on the weekend. I get up and get on my elliptical every morning. Oh, don't want to get up this morning and do that, and I know I'm not going to want to get up tomorrow morning. Poor nutrition. I try to eat well, but I don't always. I can be perfectly honest with you. Sometimes I'm too tired to cook, and I open a can of soup. Sometimes I don't want to cook, and we go out. So sometimes I'm dying for some French fries, and I go get them. But for the most part, my husband and I stay at home and eat. We cook at home. I try to make food on the weekends. I make 2 or 3 dishes on the weekends, and then we eat off of that during the week. But when Friday comes, I can tell you, I'm sick of everything that I've cooked, everything that's in that refrigerator, and I'm going out, and Bob Prezioso is going to take me. So, I don't have time to go any farther. It's time to say good night. It's been really good talking to you and having this time with you, and I will see you next week with more of Here's to Your Good Health. Good night.